If Ozempic feels like it's suddenly everywhere, you're not imagining it. It started as a diabetes medication, then it became the name people drop in weight loss conversations like it's a celebrity. So let's slow down and translate what it actually is, what it's used for, what side effects are common, and what the real red flags are. Disclaimer: this video is for educational purposes only. It does not provide medical advice, diagnosis, or treatment. I'm not a licensed healthcare professional. For personal medical questions or medication decisions, talk to your doctor, pharmacist, or other qualified clinician. All right, Ozempic. Ozempic is the brand name for semaglutide. It's in a class of medicines called GLP-1 receptor agonists. That name sounds like a robot, but the idea is simple. It mimics a natural hormone your body already uses to help regulate blood sugar and appetite signals. So what does it actually do? In general terms, it helps your body release insulin when blood sugar is high, it reduces the amount of sugar your liver releases, and it can slow down how quickly food leaves your stomach. That last part is a big reason many people feel less hungry, or feel full faster, or just don't think about food the same way. Now, what is Ozempic used for? The official on-label use is type 2 diabetes. It's used along with diet and exercise to improve blood sugar control in adults with type 2 diabetes. Ozempic also has additional risk reduction uses for some people with type 2 diabetes. Depending on the patient, it may be used to reduce the risk of major cardiovascular events like heart attack or stroke in adults with type 2 diabetes who already have established cardiovascular disease. And it also has an indication related to slowing kidney disease progression risk in adults with type 2 diabetes who have chronic kidney disease. Now, weight loss. You'll hear people say Ozempic is for weight loss, and here's the clean way to say it. Ozempic is not primarily marketed as a weight loss medication, but semaglutide, the same active ingredient, is also sold under a different brand name, Wegovy, which is specifically FDA approved for chronic weight management. So, in the real world, yes, Ozempic is sometimes prescribed off-label in a weight loss context, and people talk about it constantly. But the label, the dosing, and the exact medical decision is something a clinician has to tailor to the person. Okay, side effects. This is the part most people actually care about, and I don't blame them. The most common side effects are gastrointestinal. Think nausea, vomiting, diarrhea, constipation, stomach pain, and indigestion. For some people, it's mild and fades. For others, it's the whole story. Here's a plain English way to think about it. Ozempic changes how your gut moves and how your brain reads fullness signals. So it's not shocking that your stomach might complain while your body adjusts. If someone tells you no side effects at all, cool, lucky them. But it's very normal for people to feel at least some stomach-related effects, especially early on. Now let's talk about the stuff that matters more, the red flags and dangers. First, Ozempic has a boxed warning about thyroid C-cell tumors. The warning comes from animal studies, and it's not confirmed the same way in humans, but it's taken seriously enough that the medication is not recommended for people with a personal or family history of medullary thyroid carcinoma or a condition called MEN2. If you've ever had thyroid nodules, thyroid cancer in the family, or weird neck symptoms, that's exactly the kind of thing to mention before starting a drug in this class. Second, pancreatitis. This is one of the big don't ignore it warnings. The classic symptom is severe belly pain that doesn't quit, sometimes radiating to the back, and it may come with vomiting. I'm not here to scare you, but I am here to say this is not the kind of pain you tough out at home because a video said it's probably fine. Third, gallbladder problems. Some people can develop gallbladder disease with significant weight loss or with certain meds, and GLP-1 medications have warnings in that neighborhood. If you get right upper abdominal pain, fever, jaundice, or persistent nausea that feels different than the usual, that's another call a clinician situation. Fourth, dehydration and kidney problems. This one sneaks up on people because it's indirect. If Ozempic makes you nauseated or causes vomiting or diarrhea, you can get dehydrated. Dehydration can stress the kidneys, and there have been post-marketing reports of acute kidney injury in some cases, so if someone is getting sick and not keeping fluids down, that's not just uncomfortable, that can become medically important. Fifth, low blood sugar, but with an important detail. Ozempic by itself is not the biggest hypoglycemia culprit for most people. The bigger risk shows up when it's combined with certain other diabetes medications, like insulin or sulfonylureas. That's a medication list issue, not a willpower issue. It's one of the main reasons it matters that one prescriber knows what the other prescriber is doing. Sixth, diabetic retinopathy complications. In a long cardiovascular outcomes trial, there were more diabetic retinopathy complications in the Ozempic group than placebo, particularly in people who already had a history of diabetic retinopathy. The practical takeaway is not panic. It's that if you already have diabetic eye disease, you want your eye exams up to date, and you want to report vision changes promptly. And here's one that surprises people: surgery and anesthesia. Because GLP-1 medications can slow stomach emptying, there are warnings about retained gastric contents and a potential risk of pulmonary aspiration during general anesthesia or deep sedation. Translation: if you're going in for a procedure, your surgical team needs to know you're on it. Don't keep it a secret because you think it's just a weight loss med. Now let's talk about what to avoid, or at least what to double check. First, alcohol. Alcohol can mess with blood sugar, it can worsen nausea, and it can make dehydration more likely. Ozempic already has a nausea and dehydration pathway for some people, so stacking alcohol on top can be a bad combo for a chunk of patients. This doesn't mean never touch a drink. It means if you drink, it's worth asking your clinician what's reasonable for your situation, especially if you've had episodes of low blood sugar, stomach side effects, or you're on other diabetes meds. Second, sketchy versions of semaglutide. This is a big one right now. The FDA has warned about unapproved GLP-1 products being sold online, sometimes labeled for research purposes or not for human consumption, and that is exactly the kind of thing that can hurt people. If it's not coming through a legitimate prescription and pharmacy channel, you don't really know what you're getting. Third, random over-the-counter choices when you're already nauseated. If Ozempic is upsetting someone's stomach, adding harsh supplements, stimulant-heavy fat burners, or detox products is just asking for more GI chaos. You're not proving toughness. You're just making it harder to tell what's causing what. Fourth, medication timing assumptions. Because Ozempic can slow stomach emptying, it can change how some oral meds get absorbed for certain people. Most of the time, this is manageable, but it's exactly why a pharmacist is useful. If you're on medications where timing matters, you want that conversation. So what's the clean takeaway? Ozempic is semaglutide, a GLP-1 medication used for type 2 diabetes with additional risk reduction uses in certain higher risk patients, and it's widely talked about for weight loss because this drug class affects appetite and fullness. The common side effects live in the stomach. The serious risks to respect include thyroid tumor warnings, pancreatitis symptoms, gallbladder issues, dehydration leading to kidney stress, hypoglycemia risk when combined with certain diabetes meds, vision changes if you have diabetic retinopathy, and making sure surgical teams know you're taking it. If you want the smartest conversation with your clinician, here are 3 questions that cut through the noise. 1. Based on my history, what side effects are expected and what symptoms mean I should call right away? 2. Do any of my current meds increase my risk of low blood sugar or other interactions? 3. If I have a procedure coming up, what should my surgical team know about this medication? That's the whole point of MedLabel Translator. Not hype, not fear, just a clear translation so you know what to ask next.